If you use Depo Provera and you're noticing symptoms you can't explain, this video walks through what a meningioma actually looks like day to day and when it's time to see a doctor. A meningioma is a tumor that forms in the tissue covering your brain and spinal cord. Most are non-cancerous, but even a non-cancerous tumor can press on the brain and cause real symptoms, especially as it grows. Here's why Depo Provera is part of this conversation. Research has linked long-term use of the drug synthetic progestin to tumor growth in that same tissue. Doctors don't fully understand every detail yet, but the connection is well documented enough that it's now part of an active legal case. Let's start with the earlier symptoms. Persistent headaches that don't go away with rest or over-the-counter medication. And that may feel different from headaches you've had before. Changes in your vision like blurriness, double vision, or blind spots. Ringing in your ears or hearing loss, which is easy to write off as something else. And seizures, especially if you've never had one before in your life. Any one of these on its own is worth mentioning to a doctor. If you're noticing more than one, it's worth taking seriously and bringing up soon. As a meningioma grows, symptoms can become more noticeable. Balance problems, trouble walking in a straight line, or a general sense of unsteadiness on your feet. Cognitive changes like memory lapses, trouble concentrating, or losing your train of thought mid-sentence. Numbness that doesn't go away, and weakness on one side of your body, which can feel like your arm or leg isn't responding the way it should, or feels heavier than usual. Here's one that's easy to miss: personality and behavior changes. Feeling unusually irritable, withdrawn, or just not like yourself lately? Some women describe it as feeling foggy or like their patience is shorter than it used to be. Because this doesn't feel like a medical symptom, a lot of women brush it off or chalk it up to stress. It's worth naming directly because it's one of the more common signs and often one of the first things family members notice before the person experiencing it does. Some women are at higher risk than others. Using Depo Provera for 12 months or more raises your risk. So does frequency of use and your age. Research shows the highest risk in women who use the drug for more than 4 years or who started using it after age 31. If any of this sounds familiar, don't wait to see a doctor. Bring up your Depo Provera use specifically, even if your doctor doesn't ask. An MRI is the standard way meningiomas get diagnosed, so ask directly about imaging rather than waiting for it to be offered. Early detection makes a real difference in how a meningioma is treated and in how much of an impact it has on your daily life. If you're diagnosed with a meningioma after using Depo Provera, you don't have to sort out what comes next on your own. There's an active legal case built around exactly this connection, and it exists so women in your position have a path toward accountability, not just a diagnosis to manage alone. Michael Gunzburg, PC, offers a free, no-obligation case review, and the firm works on contingency, so there's no fee unless there's a recovery. Call the number on your screen, and if you haven't already, watch the first video in this series to understand the lawsuit itself.